Starting a company is like jumping off a cliff and having to assemble a plane on your way down. Just as Rev. Hoffman states, it's a do or die situation with a pile of uncertainties and lots of stumbling blocks that you have to fuse together with little knowledge of the business side and experience in that case. This has been our story at Matibabu, fighting to develop technology aimed at closing the gap between the communities and their rightful access to healthcare. More than 4 years ago, as freshmen at campus, with a couple of friends, we saw an opportunity to tackle a challenge that we're all familiar with, and that is malaria. Having grown up in the sub-Saharan region, enjoyed all the mosquito bites, we all have had different episodes of malaria from our childhood till this date. And we have firsthand witnessed the challenges within our healthcare systems when it comes to accurate and fast diagnosis of the disease. But the engineering students we set off to, with actually no knowledge about the mosquito and how it affects the human body, we set off to investigate how we could first close the gap between these two worlds. That's the engineering world and the medical world, by developing a kit that is aimed at improving the way we do diagnosis. And that's how Matibabu started. As seen in this picture, this is actually what happened when you go to a tier 1 clinic in Kampala, where I come from. And these clinics are accessible by most people. So when you go to this clinic, you witness that there's one doctor having to attend to over 20 patients waiting in long lines, some with their children crying, just for a simple malaria test to know what their status is. Actually, that simple malaria test takes about 15 to 30 minutes. That's from the time blood is drawn from the patient, taken to the lab, and analyzed, and you get conclusive results. That's when you're using a microscope. This process is tedious and time-consuming to both the doctor that has to look through this microscope for probably the whole day, and also the patients that have to wait in these long lines. And it cuts off their productivity when you talk about the time they would have spent going to school, the time they would have spent going to work, just by getting a quick diagnosis. Actually, when the plasmodium affects the human body, it will change a few compositions within this blood cell. So it will change the physical and the chemical composition of the blood cell. So using the principles of light scattering and magnetism, we set off to develop a kit that can distinguish between what an infected red blood cell looks like and what a normal red blood cell looks like. And this is why we offer Matibabu a solution that is 15 times faster than the traditional kits, but that also collects data in real time about the results and the location at which you're doing the diagnosis. This data helps feeding in the malaria control programs, like support the big people that are trying to change the way that we fight the disease by offering nets, so that they offer these commodities to the right places and in the right time when they're needed. So we have gone through lots of iterations from the beginning as we're trying to create a market-ready device. And this was our first generation prototype. I remember the main objective of this prototype was just to prove the concept, like try to shine light through the body and see if you can read off these parameters that you're trying to set and read of the human body and see if they have malaria or not. So after developing this, we went into the field and tried to test if it would work or not. So, and we realized that there was lots of interference with external light, and that we had to go back to the drawing board and actually move into the second generation prototype. And then with this second generation prototype, the main objective was just to help cut off these external interferences like the light and the noise around, to see that we concentrate on the light that we're trying to project onto the human skin and see that we pick up these results. Interesting enough, all this failed. So, but still, we didn't stop there. And why we didn't stop there is because a turning point came in life when we registered for this Microsoft Imagine Cup Challenge. And in this challenge, I mean, there was lots of boot camps organized in how you could do business modeling for your company, how you could actually take a project that we're doing as a class project to actually build a company out of it, which is not an easy task. So we said, let's not give up at this time. Let's go back to the drawing board and try to see what we can change, what we can do to make this better. And this right here was like 2 years into the research, 2 years trying to build up something. So we went back to the drawing board, and this time we're trying to figure out what other parameters are changed when the plasmodium is in the body. So we decided to re-engineer a pulse oximeter. And most of us that have been to hospitals know what a pulse oximeter is. It's a small clip that you put on your finger, and you can tell what your oxygen levels are and things like that. So we engineered this pulse oximeter, and the main intention was to read the different, because the plasmodium will change the oxygen levels in your body. It's feeding on the hemoglobin and things like that. So we went to the community to also do a needs assessment on this generation of a prototype. But also, we wanted to answer one of the biggest assumptions, like, are we actually solving the right problem, or we are going about the problem in the wrong way? Because we've seen a great shift in the medications available, like from the early times when malaria was discovered. But we have seen literally a slow change in the ways we do diagnosis of the disease. So our assumption was, let us change the way we do malaria diagnosis, and we see if that can reduce the number of deaths within the community, and also try to build up these communities. So we went to do this needs finding survey in Apache district, the northern part of the country. And this district has one of the highest prevalence rates of malaria. So why I'm telling you this is, when we went in to do this and we're all excited, like we're trying to change the world and we're trying to share our stories. I remember, I'll share one story that I remember. This lady came in with their child. So, and they wanted to do a malaria diagnosis. So when they came in the room where we were and were telling them about the benefits of non-invasive diagnosis, the benefits of having your kid or yourself do diagnosis faster than the traditional ways. But so we sat her down and put the kid's finger into this device and then ran the device. And within 1 minute, we produced a nice looking script on the phone saying you do not have malaria. But since the child had a high temperature, this mother was not contented. So we watched her move out of this small one-room clinic that we're in, and she moved a few steps to the next doctor, just to have their blood drawn and confirm whether it's malaria or not. But still, when she went to do that, she found out that still the child didn't have malaria. It was a normal, like, high fever, and in most cases you take tablets and you'll be fine. But the problem was just beyond offering a solution that is non-invasive and can change the way we do diagnosis. The problem also goes with the behavior towards diagnosis, the behavior towards the change in technology. It's not an easy thing to just shift from A to B. Sometimes we are accustomed to the way we do the different things we do. So we again went back to the drawing board, and this had an efficiency of over 60% when you're trying to do the studies here. But we went back to the drawing board and we're trying to ask a question of, how can we develop for all these situations? How can we develop technology that is not just fancy, but technology that is actually usable in the communities? Because the end goal is saving lives. So we went back and with a couple of partners, and we're trying to investigate how and what's the best way to develop technology that is consumable in these communities. So we went in with this magnet optic device that also transited into the 5th generation. And this device has 2 use cases, right? The first use case is to actually enable the hospitals to still do the diagnosis the way they do it, but still in a faster way and a more organized and documented way. So you can still get a drop of blood, put it in a cuvette, and put it in that fancy box, and still run this device. we noticed that this will actually drive the people into accepting the technology, into coming to actually believe the technology because it's driven from their doctors. Their doctors tell them this works. That's better than you listening to an engineer that tells you this works, right? You trust your doctor. So, and the other use cases, if you're passionate enough, you can still place your finger inside there and have your results within 1 minute. And still, we are collecting all this data, aggregating it, and supporting the policymakers in really giving them which regions need their attention. Currently, we are undergoing a clinical trial in one of the main referral hospitals in the region. That's Malago Hospital. And the main objective of this clinical trial is actually to ascertain the efficacy of the device in terms of sensitivity and specificity in comparison to the current gold standards. The current gold standards of malaria testing are a microscope and probably a PCR that is too expensive to use in any context. So after that, this clinical trial will inform our next steps, which include certification of the device and also rolling out into the communities that we have been working and trying to prep up for this rollout so that we ensure that we can save lives the way we envision to save lives. But the question still stands. How do we close the gap? Please join me in this fight to close the gap and fight against malaria.